I'm Dr. Praveen Ravishankaran, a robotic cancer surgeon specializing in advanced minimal invasive oncology. Over the years, I've dedicated my practice to treating complex cancers using cutting-edge techniques like laparoscopy and robotic surgery, focusing not just on removing disease, but doing so with precision, minimal trauma, faster recovery, and better quality of life. Every patient I treat represents a balance between science and empathy. And through this platform, my aim is to simplify cancer care, create awareness, and help people make informed decisions with confidence. Today, let's talk about an important but still often under-discussed condition, endometrial or uterine cancer. But before that, let me show you something interesting. When a balloon is filled with air and exposed to a flame, it bursts immediately. But when the same balloon is filled with water, it does not burst. The water absorbs the heat and protects the balloon. A simple concept, but a very powerful one. Now, think about this moment from the Suicide Squad, when Harley Quinn is pushed into a chemical mixture by the Joker or she jumps in. A transformation that would eventually take place triggered by a chemical exposure. In medicine too, internal changes, especially hormonal and metabolic influences, can gradually transform normal cells into cancer. Now coming to endometrial cancer. The endometrium is the inner lining of the uterus, and cancer here is one of the most common gynecological cancer affecting women. Broadly, endometrial cancer is classified into two types, type 1 and type 2. Type 1 is estrogen dependent, or in other words, dependent on the female hormone. This is usually seen in patients with obesity, diabetes, PCOD, or unopposed estrogen exposure, and generally has a very good prognosis or better outcome. Type 2 is non-estrogen dependent, more aggressive, and includes high-grade histologies like serous and clear cell carcinoma, which is very bad. One of the most important aspects of endometrial cancer is that it often presents early. The most common symptom is abnormal uterine bleeding, especially postmenopausal bleeding. That is, bleeding after menopause, which prompts the patients to seek medical attention early, leading to diagnosis at a stage where cure rates are very, very high. When we suspect endometrial cancer, the initial evaluation includes a transvaginal ultrasound to assess the endometrial thickness, followed by endometrial biopsy, which confirms the diagnosis. Further staging is done using MRI or CT scan, and in selected cases, molecular classification helps guide treatment decisions. Now, coming to treatment. For early stage disease, surgery is the mainstay. Typically, it involves a total hysterectomy or removal of the entire uterus with removal of both ovaries and the fallopian tube, along with removal of the adjacent lymph nodes. In intermediate risk cases, adjuvant radiation may also be added. In high risk or advanced stages, we use a combination of surgery, radiation therapy, chemotherapy, and increasingly targeted therapy and immunotherapy based on molecular profilings such as MMR status and P53 gene mutation. Now, let me talk about something that has transformed outcomes in gynecological cancers: robotic surgery. With robotic assisted surgery, we operate with a magnified 3D vision or a 10x zoom and exceptional precision, allowing meticulous dissection, better lymph node clearance, and preservation of important surrounding structures. For patients, this translates to smaller incisions, significantly less pain, minimal blood loss, shorter hospital stay, and faster recovery and quicker return to normal life. Especially in endometrial cancer, where many patients are obese and high risk for open surgery, robotic surgery provides a safer and far more effective alternative. It is not just a technological advancement, it is a shift towards better, patient-centered cancer care. Now coming back to our experiment, why did the balloon with water not burst? Because water has a high heat capacity It absorbs and distributes the heat from the flame, preventing the rubber from reaching its bursting point. In a similar way, when we detect cancer early and intervene at the right time, we prevent the disease from reaching a critical stage. Awareness and timely action acts as that protective layer. And that brings me to the most important message of this video. Endometrial cancer is one of the very few cancers where body gives an early warning sign of abnormal bleeding. Ignoring it can delay diagnosis, but acting on it early can lead to complete cure. We are in an era where cancer treatment is evolving rapidly with better diagnostics, advanced surgical techniques like robotics, and personalized therapies where outcomes are better than ever before. But the key still remains awareness and early evaluation. So if you know anyone who experiences abnormal uterine bleeding, especially after menopause, please don't ignore it. Seek medical advice early and immediately, because uterine cancer is one of the very few cancers that can be cured if detected early. If you found this video useful, share it with someone who might benefit from it. It would be better still if you could share it with all the women you know in your life, because knowledge is the key for early detection, and early detection leads to cure. Subscribe to the Wellness Oracle for more clear, practical, precise, evidence-based insights into cancer care, and stay tuned for the next video where we continue to simplify and demystify cancer and its causes, one topic at a time. Thank you and have a great day ahead.